Living Kidney Donation. Welcome to the New York Presbyterian Hospital, Columbia University Kidney Transplant Living Donor Education video. We are here to provide the very best personalized care and assistance to you. Kidney transplant is considered the most effective treatment for patients with end-stage renal disease, the final stage of kidney failure. Kidney transplant provides a survival benefit for patients who would need dialysis. On average, kidney transplant patients can expect to live twice as long with a kidney transplant as they would on dialysis. The decision to proceed with a kidney transplant represents a strong commitment to self-care and medical follow-up. Patients who are potential kidney donors need to undergo an evaluation process. The Columbia Kidney Transplant team will perform a thorough evaluation of a potential kidney donor's medical and general health to determine if kidney donation is safe. The donor team consists of a transplant nurse coordinator, a nephrologist, a surgeon, a social worker, and a psychiatrist. For anyone interested in donating a kidney, there is no financial liability. All services, from the evaluation to post-operative care, will be paid for by the potential recipient's Medicare or the employer health group plans, such as private insurance carriers. The first visit to our transplant center consists of a history and physical, blood testing, urine collection, an electrocardiogram or EKG, and a chest X-ray. All medical information and testing results are kept confidential and are only discussed with the potential donor, not the transplant candidate. The second visit consists of an evaluation by the transplant psychiatrist, a CT scan of the kidneys, and any other testing deemed necessary by the team from the first visit. The final evaluation is done by the surgeon. Once the potential donor has been evaluated by the donor team, a conference is scheduled to discuss the potential donor's suitability for kidney donation. We want to make sure that it is going to be safe for the donor to undergo surgery and anesthesia, and that the donor is going to be okay long-term with just one kidney. Also, we want to make sure that from a psychological standpoint, the donor understands the living donation process, that they can give an informed consent, and they are not at high risk for depression or anxiety disorders. Finally, we want to make sure that the donor has 2 kidneys and that both kidneys are normal. If the potential donor is accepted to donate, a transplant date will be scheduled. At least 1 week before surgery, preoperative testing for both the donor and the transplant recipient are scheduled. At New York Presbyterian Hospital Columbia, we perform our donor operations laparoscopically under general anesthesia. The operation generally takes between 3 and 4 hours. In this operation, we make small incisions and use a small fiber optic TV camera to see inside your abdomen and use tools to remove the kidney through a 2 to 3 inch incision. Rarely, in less than 1% of cases, we may need to convert to an open, larger incision operation. But we wouldn't know until we were actually in the operating room performing the surgery. This would only happen if we were concerned about injuring the kidney, concerned about injuries close by organs,